Hospitals. Introduction to a hospital. Jordi Pons is a four-year medical student from Barcelona. He has come to Britain on an elective attachment to the Royal Infirmary Edinburgh. Dr. Baron is introducing him to the hospital. Dr. Baron. The Royal Infirmary is the name of the University Hospital for Edinburgh University. It's a general hospital dealing with all types of patients and illness except pediatrics. We have a specialist hospital for that in another part of Edinburgh, the Hospital for Sick Children. You can use some of the departments in our hospital on the site. Of course, there are many others, for example, the Intensive Care Unit, ICU, and the Surgical High Dependency Unit, HDU. Jordi, what does outpatient mean? Dr. Barron. Outpatients are the people who come to hospital to attend a clinic or to have tests or attachment and then return home of the same day. Inpatients stay in the hospital for one or more days. The rooms where they stay are called wards. If a patient's treatment requires only one day, such as simple operation, they can be admitted to the day surgery limit. B. Outpatients. Dr. Baron. The accident and emergency department, also called casualty, is where patients who are critically ill with a sudden serious condition come for assessment and treatment. Outpatients who have an appointment to see a specialist go to a clinic in one of the outpatient departments, OPDs. They have usually been referred to the hospital by their GP, who writes a referral letter to the consultant explaining the patient's problem. See inpatients. Dr. Baron. The inpatient in a hospital admitted in one of three main ways. They may be seen in one of the outpatient clinics and admitted from the or if there is a lot of demand for the treatment they need, as in the case of a hip replacement, they are put on waiting list for admission. Alternatively, their GP may arrange the admission by telephone because they are acutely ill, for example, with suspect myocardial infarction, or they are seen in the AE department where the doctor and Dory working at the time arrange the admission. This will happen in the case of a patient with a fractured neck or femur, for example. The hospital may be an assessment unit where patients can be admitted temporarily while their condition is assessed. Jordi assessed. Dr. Barron, yes, decisions are made about the condition and what needs to be done to help them. After treatment is complete, the patient is discharged back to the GP's care. Hospitales. Introducción al hospital. Jordi Pons es un estudiante de cuarto año de medicina de Barcelona. Ha venido a Gran Bretaña para hacer una estancia optativa en la Royal Infirmary en Edimburgo. El doctor Baron le está presentando el hospital. Doctor Baron. La Royal Infirmary es el nombre del hospital universitario para la Universidad de Edimburgo. Es un hospital general que trata todo tipo de pacientes y enfermedades, excepto pediatría. Tenemos un hospital especializado para eso en otra parte de Edimburgo, el Hospital para Niños Enfermos. Puedes ver algunos de los departamentos de nuestro hospital en el letrero. Por supuesto, hay muchos otros, por ejemplo, la unidad de cuidados intensivos y la unidad quirúrgica de alta dependencia. ¿Qué significa paciente ambulatorio? Doctor Barron. Los pacientes ambulatorios son las personas que vienen al hospital para asistir a una clínica o para hacerse pruebas o tratamientos y luego regresan a casa el mismo día. Los pacientes internos se quedan en el hospital por uno o más días. Las habitaciones donde se alojan se llaman salas. Si el tratamiento de un paciente requiere solo una operación simple, pueden ser ingresados en la unidad de cirugía de día. B. Pacientes ambulatorios. Doctor Barron. El Departamento de Accidentes y Urgencias también llamado urgencias, es donde los pacientes que están gravemente enfermos con una enfermedad grave repentina acuden para una evaluación y tratamiento. Los pacientes que tienen una cita para ver a un especialista acuden a una clínica en uno de los departamentos de pacientes ambulatorios. Generalmente han sido remitidos al hospital de su GP, quien le escribe una carta de remisión explicando el problema del paciente. Pacientes internos. Los pacientes ingresados son admitidos de tres maneras principales. Pueden ser vistos en una de las clínicas de pacientes ambulatorios y ser admitidos desde allí, o si hay muchas demandas de tratamiento que necesitan, como en el caso de un reemplazo de cadera, se les pone en una lista de espera para la admisión. Alternativamente, su GP puede gestionar la admisión por el teléfono porque están gravemente enfermos, por ejemplo, con un infarto de miocardio sospechado o son vistos en la unidad accidental y urgencias durante el médico de guardia que trabaja en ese momento gestiona la admisión. Esto sucedería en el caso de un paciente con una fractura de fémur. Los departamentos de evaluación de la unidad más grandes pueden tener un paciente interno que puede ser ingresado mientras se evalúa la condición. Evaluado si se toman decisiones sobre su condición y lo que se debe hacer para ayudarlos. Una vez finalizado el tratamiento, el paciente está dado de alta para ser atendido por GP. Complete the table with words from A, B, and C opposite. Put the stress mark in front of the street syllable in each word. Admit, admission. Assess, assessment. Discharge, discard. Operate, operation. Refer, referral. Treat, treatment. Make word combination using a word from each box. Acutely ill. Assessment unit. On duty. Waiting list. Referral letter. Which hospital department will be most appropriate for the following patient? A woman in diabetic coma, intensive care unit. A patient who has just a radical prostatectomy, high dependence unit. A patient who is have a skin lesion removed, surgical unit. A man with a foreign body in his head, accident and emergency. A woman with a treatment abortion, gynecology emergency. Information for outpatients. When you arrive at the hospital, please tell the receptionist who will welcome you, check your details, and direct you to the waiting area. The length of your visit will depend on the treatment you are going to have. You may need to have some tests, such as an X-ray, which could mean going to another department. You may be referred to the other professionals, such as physiotherapists or dietitian. You may need to revisit the clinic. If staff of the clinic want to see you again, another appointment will be arranged for you. If you need to be admitted to hospital for more treatment, either as an inpatient of the day surgery, you'll be told when this is likely to happen. If you don't know a need for the treatment, you'll be discharged to your GPS care.